Okay, so we're going to go live now. Okay, so good afternoon, Tewksbury. It is 1:00 p.m. on Tuesday, May 12th, 2020, and I'd like to call this emergency meeting of the Tewksbury Board of Health to order. One of the things that we have been talking about offline meeting is just that given the state meetings that others are involved in with the health department, specifically the Department of Public Health has a 3:00 conference call with health departments on Tuesday afternoons. Susan and I were discussing about the need to change the day for our meeting. So now we're going to be looking at doing these Wednesdays. We'll come up with a time and we'll see what works for everyone, but a 1:00 start at the earliest. And this way, whatever news comes out of the DPH meeting, Irvy has a meeting with public health nurses also on Tuesdays. And the governor recently has been making announcements that relate to what we're talking about and we're responsible for on Mondays and Tuesdays. So by moving to Wednesday, hopefully we'll have all these news items already out there that may be pertinent to what we're discussing. So on today's call, the topic is really going to be more focused on the business is reopening and trying to get life back to normal. And I'll preface it with just a couple of remarks, and I'll turn it over to Susan and Richard for an update from the town standpoint. As the state or the governor released some tidbits of what this reopening advisory committee may be having for recommendations, I think the key thing to keep in mind is that, there's a lot of talk about what businesses may be opening first and where other businesses in terms of priorities. And as we talked at the last meeting, there is a real recognition, at least locally in Tewksbury, that a lot of small business owners are hurting, and the sooner we can open businesses up, the better, but also understanding that there's going to be a new normal for a while that we'll all have to go through, both on the consumer side as well as on the business provider side. And what that's going to look like, we don't have the details yet, and waiting for the state to come out for that. But I think the two key things is if we step back for a minute and not focus so much on COVID-19, but just more about infection control in general. I think that everyone all across the U.S. and internationally has sort of dropped their guard when it comes to best practices for infection control for a host of reasons. And I think one of them, at least in the fall and winter time for us, has been we're now getting the flu shot as a common thing. And before flu shots came out, when flu season was around, people were very cautious to really practice good hand washing, good hygiene, going out of the way to avoid people that were coughing and sniffling. But then once the flu shots came out, people tended to drop their guard. And I think that's part of the reason we may be in some of the predicament that we're in now, is that we had forgotten about some of the basics of infection control. And I bring this up because as businesses are able to start reopening, and whether that's at the state level or whether that's actually delegated down to local community level, and we're still waiting to hear from the state about how that's actually going to pan out, whether the state or local communities will have more of a say in what opens and when. I think the biggest thing to keep in mind is that whether people can debate whether all these measures, wearing the face masks or hand washing, social distancing, whether you agree with them or not, to me, that's your own personal decision. However, if the end goal is to try to get life back to as normal as it will be moving forward, the shortest path to that is 100% compliance with everything that is being asked of us to do. whether it's the social distancing, wearing the face coverings, whether it's frequent hand washing, and whatever temporary, short-term or longer-term requirements or guidelines to be put in place for businesses to change how they operate. That collectively, if we all do our part, and fortunately this is a case where everyone has to be part of it, that will then hopefully shorten the duration that'll take us getting from where we are now to where our new normal life will be at the end of all this. And there will be light at the end of the tunnel. It will not be an oncoming train. Things will be fine. But I think moving forward from this, we're all going to have to be much more aware and get back to the basics of infection control. And whether that's in the nursing homes, assisted living facilities, to a lesser extent hospitals, but really at the home setting and in business settings, we all have a part to try to ensure that we get businesses able to open back up, life back to normal, and then moving forward to keep implementing as many of these practices where it makes sense to ensure that we all try to stay healthy moving forward so that we don't have a repeat of all this again. So that's sort of framework I wanted to structure today on. The governor did release on Friday a 4-page PowerPoint slide. Actually, I guess it was 3. And there wasn't a lot of meat to it. It was just talking about a 4-phase approach to reopening Massachusetts. And then the lieutenant governor come on and reviewed mandatory safety standards for workplaces and was very clear to say that these are not guidelines or recommendations. These are what all businesses will need to follow as businesses are allowed to either open or essential businesses remain open. And it's going to be a challenge locally because it seems like the rules are constantly being modified, tweaked, rewritten. And the last piece I'll mention about this is that, and we'll take the golf courses as a prime example of this. And we talked about this at the last meeting. Without having science behind the changes or the recommendations or guidelines or requirements of why we're asked to do something, it's hard for people to sort of wonder why, especially if there'd been guidance for us not to do something and all of a sudden next day, now we are to do it. And on the golf courses, for example, and I'm an avid golfer and I can't wait for my league to start. This is a disclaimer. There was a thing about golfers have to go out in 15-minute intervals, whether it's single, twosomes, or foursomes. And as far as we've been able to determine, there is no science behind the 15 minutes. That's an arbitrary number. And as a golfer, I can understand, yeah, you want to make sure that you allow enough time between groups on the golf course so you don't have groups backing up, and then it's hard to maintain social distancing. So I think it's incumbent upon us, and I'll put this as a quick sort of straw poll for the board. Moving forward, I see that the health department really has 2 different tracks they can take. One is either enforcement and making sure that they're the business reopening and face covering policy regulators, making sure that everyone's doing all that, or should be more of a, as we've been trying to have them do, more educate. We need to educate both consumers because they can vote with their wallet in the pocketbook. We need to educate the businesses, and we really need to try to, where there isn't science behind some of these recommendations, come up with some reasonable science that would support these recommendations that are being put forward, absent of that science being part of the documents being issued either at the federal level or at the state level. So just as a quick straw poll for the board, it's not a binding vote, I'm just curious, litmus test. Do you think that the health department and we, the board, should be more focused on making sure that everyone follows the regulations as they're coming out, or is it more on we need to better educate both sides so that collectively everyone knows why we need to do it, and aside from whether we agree with it or not, but I'll get everyone realizing the sooner we can all do this, the sooner we can get things back to whatever the new normal is going to be.
Okay,
So Maria, I'll just put out first to you.
Yeah, could you have everyone and say the names, whoever wants to speak first, so we get the roll call at the same time?
Sure. So Maria?
Maria Zaroulis, clerk, I'm here. I think that the education piece is probably the most important thing, because it seems like a lot of people, they're getting the information about what's required to reopen, things that they're going to have to begin doing, but there seems to be confusion as to why. You know, some places say, oh, we already do that. Some, you know, I think it really needs to be explained to each individual business, because they all operate a little bit differently, why these new regulations are so important for them to reopen as soon as possible. That's my thought on it. As far as the health department staying on top of that, I don't know how you would go about following up with all these businesses so often to make sure that they are complying with all the new regulations. I don't know if that would be too much of a challenge for you to do that, or how often you would do it.
Okay, well, thank you for your voice. And Charlie, how about you? If you want to just say your full name and then your thoughts.
Yep. Charlie Rue, and for the last 3 weeks, I've been expressing my opinion about how we're working this, and it seems we're working it still as a top-down phenomenon here from Charlie Baker. We're waiting for him to have an epiphany, which may or may not occur. And I've been at the point on ground zero here where we need to get reopening plans from businesses. They need to be reviewed for the people that we permit in the Board of Health. The other businesses need to be reviewed from whoever Mr. Montori puts in charge of it. They need to follow the guidelines that we set according to what the state instructs us to. I'm still asking, and I haven't gotten the question answered yet as to whether or not David Robinson or Representative Wynn or somebody else is listening to these conversations, because to be quite frank with you, I think they're going into the air and they're not going anywhere. And it's becoming very frustrating on my end. We're the town of Tewksbury. We're elected officials for the town of Tewksbury. We have responsibility for the town of Tewksbury. We're not Lawrence. We're not Springfield. We're not Worcester. We're not Boston. You know, this isn't the United States of New York, as I said, with President Cuomo. This is Tewksbury. And I think a lot of these businesses are ready to open. And if we just require them to put together a reopening plan, we can identify what the specifics are, to Maria's point, around if we agree or disagree, or if we want to elaborate on anything they put forward. But I'm in the same place I've been for 3 weeks, Ray. And that's all I got to say. Thank you.
Okay. Thank you, Charlie. Tony?
Yeah, I'm here.
Just you want to say your full name first?
Yeah, Dr. Bichetti, Tony Bichetti, Anthony. I agree with Charlie that we do have to open up. I agree with Maria, we have to do education. I also, like to say, I was born in night, but not last night. I think there's going to be a component of enforcement that's going to need to be done. I think part of the enforcement will be done by the public, because the public is aware. So when they enter business, if they're finding things that aren't done according to the guidelines, and I think that we need to have on our website the standard guidelines, the minimum that they do have to follow. And then I think we'll get some people calling. I don't want to see an over-aggressive. People sometimes will find fault with some things that they may or may not be aware of. Like I said, sometimes they don't know what they don't know. But I would suggest that we do it. an education piece, as well as spot checks, trust but verify, because I have found human nature is such that people do what they're supposed to in the beginning and then they get a little sloppy afterwards. And also, you may have one person of a team not doing things the right way that can sink the whole team. You have to be in it together. And I got to tell you, my whole philosophy in saying is these people that have businesses, they should be aware of what the guidelines are to run their business. I think I've brought it up at other meetings. If you're going to be in business, you better know what you're supposed to know. And on top of that, there's a few more things now with this COVID-19 situation that's come about. So I just think people have to step up the ante a little bit, because it's imperative for them to make sure they have clientele that comes into their businesses. And on top of that, it's going to be imperative that they make sure that they're staffed so there are no breaches, because they're only going to be as strong as their weakest link. And I think it's going to be constant reinforcement, constant training on their part, constant review of the protocols that they have in place, and to make sure. I mean, I know personally, I've heard from some people that have frequented some establishments that were open already, and things as simple as maybe just washing your hands to do it. So I think we're going to need to do a little enforcement, and I hate to say that sometimes there may have to be some actions taken that people are very fearful right now, the public, and as they said, there's probably going to be 3 waves. People that will go out and avail themselves of services immediately, some others that may wait a week or 2, and others that will hunker in until they have a vaccine. So education is important, and it's always been important, but I also think we're going to have a component of enforcement being there. And as I said, I think the public will help us on reasonable violations, not excessive calls when people nitpick everything because they may not. And that's going to be a burden on our director and the others that are within the health department. But that's kind of where I'm coming from. Educate, but I think you're going to need some enforcement as well, because I just know that people are going to start off okay, then they're going to lull into a state of lapse. And I think that we have to be aware of that. They start getting a little lax.
Can I have 2 quarter pounders with cheese plain and a large fry?
Okay, well, thank you, Tony. And Bob, are you on the call?
That's going to be that's going to be him ordering.
All right, that's 1623 for Cinda, please.
Can you get enough virtual stuff for the rest of us while I'm driving? I'm getting a little.
A quarter pounder. Wow.
Well, we know he likes McDonald's and Burger King.
You guys can hear me?
Yes, we can.
I guess
Did you
that
get-
mute button on my
Would you like to
phone
know
is,
you're doing this?
does anyone need anything is, I guess, the next question.
Now I'm
Yeah,
hungry.
I'd like a couple of virtual Big Macs, please. I'm driving now. Maybe we can transport them to the line.
That's too funny because I can still see the mute thing on in my phone, but it's not.
Yeah, well, Governor Baker's listening to all our calls.
Well, I'll get him
Are
something
they
too.
wearing
if it's
gloves?
necessary.
Exactly.
Oh, that's too funny. So anyways, you were saying, Tony, you thought you needed enforcement too.
I just think we're going to need a component of enforcement. I mean, human nature is such that everyone's gung-ho doing the right thing, and I think most people will. I think the problem that you're going to run into is some, like as I said, if you got 10 people working and one person's not doing what they're supposed to be doing, it breaks the link that needs to be done. And I think that it doesn't hurt to trust but verify. I really don't. I think it'll help keep people. I think sometimes people need a little bit of extra motivation to keep it up. I would assume that the clients and the public will be the ones to be doing that. But if we get complaints coming into the Board of Health director and they have to, we get too many of them and they're the same complaints or whatever. I mean, I think a lot of people are going to be vigilant looking out. So I think we have to, not be so crazy that you take every little complaint, but I think we do have to have some enforcement actions. I mean, I just think human nature is such that people will do it in the beginning, but they'll get lax. I mean, I can only speak from my 64 years of familiarity with people and human nature that you tend to get lax on things. And also, there's additional expense associated with this. And we've all seen how when in the past, as I said, I'm all for, people, if you're in business, you should know what you're supposed to do. But past experiences show me that other factors come into play. They don't have the money to do certain things. They're not able to get the supplies as needed. So adjustments are going to need to be made accordingly. I know in our business right now, we're having a problem with getting face shields, and it's mandatory for business to be getting face shields. So I think that a little enforcement won't hurt, and I feel bad for the people that don't continually revisit what's necessary with their staff, because I think that that possibly could enhance the spread of the disease if it's as contagious as it appears to be at this stage of the game. So you can't have any breaches. So constant training, constant vigilance on the staff. And like I said, I anticipate some enforcement. Not, education's good, but you can lead a horse to water. You can't make them drink. And that's what my concerns are. So I hope everyone else will give me their opinion and insight on that. I think a little bit will be fine. That's all I have to say on that right now. So
yes, it sounds like we're all on the same page with that. So let me turn it over to Susan Richard and you can sort of give us an update in terms of how things are going with communicating with businesses about what they need to be doing or the plans they need to be getting. And I know, Susan, you shared with me that you've gotten a couple of plans submitted from some local businesses, and those seem to have been done not on their own, but more in concert with whatever professional trade organization or association they belong to. So I'll turn it over to the two of you to sort of give us an update on just where things are and where you see the next steps going.
So, Richard, do you want to follow up on what you and Shannon and Lisa worked on Friday as far as getting the list out and the local businesses?
Sure. So we put together some guidelines and best practices that we took from both the private sector and other in the public sector that we thought good guidance for businesses to use as we get closer to the governor opening up the economy. And they were strictly best practices and guidelines. They weren't regulations from from your board or the state. And we put them on the website, and we emailed over 100 businesses that we gathered emails from the business certificate list that the town clerk has on the website of various businesses, and getting email address information. We sent that out Friday. As I said, it was over 100. There were many businesses that were missed because they didn't have email addresses, but we sent out a web alert and information out on social media businesses with the link to the website, so they could start gathering some information on best practices and guidelines. I know that we sent it to the Board of Selectmen. I think it was sent out to the board members, and some members sent it out through their contacts on their Facebook. So I think it reached a large group of people. We got some compliments on the information that we had on the website. was helpful, and I think Susan and Shannon received responses from businesses already with plans. So it's out there. Any businesses need to review the guidance and the best practices that we put together.
Thank you, Richard. Yeah, to reiterate, these were just some information and guidelines. And the reason we put it on the website is we thought it might be best to do that rather than send out specific attachments, because we want the website to be where we can change it, change this information, because obviously it changes literally over the weekend. Things changed, which I know you all know causes problems for us trying to do enforcement. We did the best we could with no notice about the golf. So thanks for bringing that up, and thank you for your support on, giving us some guidance and guidelines of what the board would like us to do with this change. Not knowing what it's going to be is the biggest thing. So the few businesses I have heard from, their industries have spent time either on their own web, Zoom meetings, and they also met. Sometimes they actually had one of the 17 people who are on the governor's council to sit in on the meeting. That specifically was a gymnastics one. And they have kind of put together a plan for, I want to call it phase 1 and 2, not the governor's phases, but they're calling them their little phase 1 and phase 2. So, and, laying out all the, all of the things that they would do to keep it safe and to keep the social distance as much as you can in gymnastics, keep the, interaction with the children minimum. So we have that. It's not up for us. We're not really reviewing them in a way of, whether we're saying they're right or wrong. I think, like Tony said, it's individual. So until they try it out, even they won't even know if it's the right plan. So, and it should be modifiable, just like any other plan that you do to prevent either foodborne illness or anything else. So everything should be something you work with and change. So, and then a couple of local businesses, that think, okay, I'm kind of like a golf course, so here's what I think I'm going to do. And I haven't even really looked at them, but, again, it's not up for us to say it's okay. But when we get our guidelines, at least we can, I hope, connect, with them and help them tweak theirs. Now, if people open without asking us, that's kind of what happened with the golf. It just exploded because they just made the announcement and everyone just opened. So they all read the same thing, interpreted it their own ways, and went running and started playing. And of course, when you do that, you don't take thoughtful time to really look at all the rules, mistakes get made. So I am working with them all, and I know you've probably seen conversations about different towns and closing down golf courses and things like that. I did not close any golf course, but I am working with those we've had complaints. The one we've had complaints against really is one in general. So
Susan, I don't mean. Oh, sorry.
Go ahead.
No, go ahead. I don't mean. I think Susan's right on point. Every business, they have the main guidelines, and they're evolving. But every business is a little different. Like certain restaurants have different sizes, shapes, whatever. I think every facility has to customize the plan, just as Susan was saying, and tailor the plan to their needs as the guidelines are now. And then it's a living, breathing, basically, policy, because the dynamics can change based on information. This is all new. The science is even changing as we're learning too.
Yeah, exactly.
But one thing I would recommend, and Richard brought it up, I thought it was interesting. If a business does not have a way for us to contact them, and I find that's been troubling in the past, by an email address and a phone number, when they submit any plan, then I think that it's imperative that we be able to contact them, because I am a little bit annoyed everyone has to have a contact. When you have a business, they got their phone numbers there for people to make appointments or schedule things or do whatever just to get there and their addresses. I think that especially now, so where we do have this emergency situation with COVID-19, that any business better make sure that we can get a hold of them immediately, and they better respond within a reasonable amount of time, because if there is an issue or a breach, or in our case, like you're finding out with the golf courses, people are, for lack of a better, are informing on them. So I think that we need to be able to get a hold of them, and if we do not have that information, I think that we should consider that as part of the process and the fact of reopening. It may impact it if they don't have that information, because I know we've come up with that, and Richard just stated that, you know, we haven't heard, and I know Shannon in the past was trying to reach out to people in the past, and no one was able to be contacted because they didn't leave a email address or a phone number. So that's my only take on that. If we're going to be dealing with a constant communication between the businesses, has to be imperative. And when I mean constant, I would say that if we find an issue, we ought to hear back from them within that day, no later than that day, so that we can address what are the concerns of either the public or the concerns that we may have, I mean, you may get some employee concerns coming on too. So, as I said, that's imperative that we need to be able to communicate with them, and I think it should impact the applicants for opening.
So just to follow up on that, because you know, we're learning about these things too, and we talked about business certificates. Who needs business certificates? Things like that. So, or so with the town clerk's list, I didn't know that list, when you get your business certificate or you register your name, whatever you might call it, it's good for 4 years. So it's incumbent on you to change that.
Correct.
And to even let them know when you're out of business. So we had a list, and there were a ton of business on it that were already closed. And also that Denise did note, you know, they hadn't been asking for emails, and she is actually going to, you know, look at what information they're asking and adding that, because it is becoming a good way to contact people. We had phone numbers, but it would take quite a bit to call everyone, and we have their addresses too. So, you know, yeah, even our systems are going to change and get better.
No, that's good. It's all incremental improvement, which is fine. I mean, but yes, that's the funny thing that, as I said, why I think enforcement's going to be necessary, because when someone's in a business, and we've had it come up in other meetings, in my view, that they're in a business, and we are there to help and provide some guidance, and not to be restrictive, but try to follow the rules the laws as it's been established. And I get somewhat annoyed when I'm trying to explain to someone what they need to know from a business standpoint, and we're not even in the business. We're there as elected officials to help them interpret the guidelines. And I'm like, if you really don't know what you're supposed to be doing in business, especially now, then maybe you shouldn't be in that business. And the part of when I have business certificates, and it says you got to renew them every 4 years and let people know. I do know that sometimes things don't happen. So I think it's great that we're learning this, but I think for the public, the people that are in business, they should be knowing this stuff too, because I mean, yeah, it says right on there, it's renewable every 4 years. So, and I know people do forget, and maybe it's something that we're improving the communications that we should be let known. But I think it's imperative that we have constant communications, because you are right, the rules, the guidance may change, and we need to let people know immediately. Nowadays, everyone has a cell phone. Pretty much everyone has email, whether they choose to acknowledge the phones when they ring, whether they choose to acknowledge the emails when they come. I think from a standpoint that they should at least be acknowledging things that are germane and pertinent to their business operations, and any issues that may arise, or any good things that may come out of it, because they need to know what they are in the business of, or the services they're providing. They need to know as much as they can, and If they don't, then I'm going to have some real concerns with when it comes time if issues do come up, whether they should be in the business of doing this. I deal with it every day in my field, and I see it. So, but I'll leave it at that. But thank you, Susan. I'm glad to hear we're improving the communications as well between all our departments too.
Okay, so I'll stop
Mr. Chairman.
with what I was saying right there, but it sounds like Charlie wants to say something.
No, I want to, thank you, Susan. I'm going to reiterate and be redundant, which is what I do best, I guess, these days, is if we had a reopening plan that was for the public to review upon entering the business, which isn't the Iliad or the Odyssey, it should be like on one page, one sheet of paper should do it, then the public themselves will police it. We don't need to, I don't think we need to get involved any more than the fact that if they're doing something that the town didn't approve as a reopening plan, and as they enter the business, they're looking at it. If something's not going the way that they said they were going to handle it prior to opening, then the public will police it themselves. And hopefully I don't have to reiterate this again. I'm getting tired, but thank you.
Now, one other thing that to segue with what Charlie was saying. Am I still on? I can't tell.
Yeah, you're still on.
Yes.
Oh, okay. I'm sorry. I believe the rule is still in place for no greater than groups of 10 in one smaller venue at any time. And I did notice in my travels around town, I saw some businesses that said 10 people. And they were patrons, but I was wondering. I didn't have the opportunity to just stop and just educate myself more. But I think that we want to find out too, as well as whatever the governors, if they're going to modify the numbers or whatever, increase it, because some of these facilities were a little smaller. If they're having 10 people in, I think that people have to remember that there has to be an accommodation made for the number of employees as well. And if they can maintain the masks and the physical distancing, then I think in some case, some adjustments may need to be made for the businesses, because I think that that's what, as Charlie said, people are going to self-police, and I think that's a great thing. But I think that that outline or synopsis of the guidelines, that we keep it simple for the public to know, so they can at least be fairly educated as a general rule for what all businesses have to be. I mean, unlike the bigger facilities like Home Depot, Market Basket, other things, because some of the businesses, they have plenty of space and others they don't. And I think that I know, for example, I went into one business in another town, and there were quite a number of people there, and it seemed to be everyone was doing things safely, but there were more than the requisite 10 people and employees in there. So I think that we just have to make sure that people are following a reasonable set of guidelines. And I think it'll be helpful having the public oversee this process as well from if they're going to frequent the businesses. Thank you.
Mr. Chairman, I'm back online. I was disconnected. Did you hang up on me?
Nope.
Oh, sorry about that. I didn't hear any response, but that's fine. I'll hear it later, I'm sure. Thank you.
Okay, anybody have any questions for Irby with what's going on out there right now while we have her for a few minutes? Or
give us an update. Hi, Irby. Can Irby just update us on what may have transpired this week already?
Yeah, sorry. It took me a while to move my mouse over to the unmute button. So numbers are definitely looking better. our residential, like I said, our community residents, that number has gone down a significant amount, which is great to see. And I know that one of the assisted living facilities had the National Guard come in last week to test their residents, and they actually came back with no positive cases. They tested 80 residents and 39 staff members, and they all came back negative. So that was really good to hear. We're talking a little bit right now on the public health nurse side of things, just the difference between the serology testing, which is the immunoglobulin testing in terms of immunity, because that's kind of the next phase of testing, versus the PCR, which is kind of the gold standard, and kind of what the differences are between the two. I can speak a little bit more about it if you'd like next week, because like I said, it's really kind of new to even us right now. The Community Tracing Collaborative is going well. I've sent a few more cases over to them, and I've been in touch with the supervisor, so that's good because the lines of communication are open, which is always helpful to get the job done. Does anybody have any questions?
No, that's good to hear. Numbers are going down. Thank you.
Yes, the
Charlie
numbers.
said we're not the, yeah, that we're not the city where they may have a different model for opening that they have to deal with. We're in the suburbs, so that's great to hear.
So the numbers are going, are reducing, but we need to keep doing what we're doing, which means socially distancing, physically
Correct.
distancing, wash the hands, wear a face covering. So we're doing a good job, and we have to remember to just keep it up, so that our numbers continue to go down. And as we reopen the town, like I said, we want to make sure we're continuing to do those things because we really don't want to see a spike. We may get a little bit of a jump in numbers, but hopefully it won't be too bad. So, can't reinforce enough the hand washing and the physical distancing and the coughing.
I have a question, Irvi. I'm not sure if you can answer this. I'm just curious, through the tracing program, has there been any pattern that has stuck out of either maybe where, like, is there something common between all the people in the community that where they had been or someone they were in contact with that before they contracted the virus? I'm just curious if there's any patterns that has been noticed through the tracing program. I don't know.
The only pattern that I can notice is that it is a lot of healthcare workers.
It is.
Yeah, it's a lot of healthcare workers who are getting workplace exposures, whether it's in a hospital or in a long-term care facility. We've had a few other employees, a few other employers where there have been clusters, and we're working with those businesses to make sure that they're, on top of their infection control and really reinforcing the, check the temperature. If you have symptoms, stay home. It's the same thing. We just got to keep doing what we've been doing. And I don't know if Susan wants to elaborate any more on that. Do you? Okay. All right.
May I ask one more question, Irvi?
Yeah.
Is the state still vigorously doing the contact tracing? Because I've been listening to some experts, and it's almost like the contact tracing, as the numbers go up, as they find more people are exposed to the virus and are asymptomatic or have recovered properly, that the contact tracing is almost irrelevant. It's meant to be in early stages and more confined locations. So from a resource standpoint, and also a lot of extra work that people are doing, have they lightened up at all on the contact tracing since they started? Or because now, from what I've heard from experts, they're saying that it's important at this stage of the game when so many people have it already. It's the work would be too voluminous, and it's not going to give you. It's going to take so much time that the benefits or there's going to be diminishing returns on the contact tracing. So I'm wondering, where we are with that. Is it still ramped up, or is it slowly diminishing?
It's actually increasing. The MDPH just released new
That's what I
guidelines
was afraid of. Yeah. That's,
yeah. They
that's
just
what I'm
released.
afraid of.
They just released the new guidelines yesterday, and they've basically said that anybody that, so for example, if I'm calling a COVID-19 positive case in the community, when I'm speaking to them and when I'm doing their intake and asking them who their contacts are, when I contact those contacts, the new guideline is actually that contact should be tested to see if they've, if they've had an exposure, but are they actually carrying virus? Are they infectious? And the reason for that is the sooner we can isolate people that are positive, the sooner we can stop the spread. That's kind of the thought process behind catching those cases early.
No, and I understand that. That's coming from the state or the governor's office, correct?
Yeah, that's coming from the state, Mass Department of Public Health. Yeah.
Okay,
So now when
that's okay. Yeah. Yeah,
Okay.
that explains it because, like I said, the experts I've been dealing with are more on a national level, a federal level, and their opinion is a little bit different than what we've got going on for the state. But I just wanted to see how it impacted us with the state. So, but that's fine. Thank you.
Yeah. So don't be surprised if you get named as a contact if the person that's calling you advises you to be tested, because that's kind of the new standard as of yesterday.
Yeah.
Will it still be their
Yeah,
choice,
okay.
Irby?
Yeah, it is their choice. Yeah,
Okay.
it is their choice. Yeah.
I think a lot of them personally, I think they're going to want to do it, because to sit and just wait for 14 days to see, and you might be an asymptomatic carrier, I think they're going to, be okay with doing it because it kind of get it out of the way, and it's not as hard to get in there now. So that's good.
The other thing is if you're listed as a contact and you come back positive, your isolation period could actually be shorter than your quarantine period, because the isolation period is the quarantine period is 14 days. And the quarantine is for asymptomatic exposed people versus if you test positive, it's 10 days. As long as your symptoms are improving, your respiratory symptoms and your fever has resolved. So, so your isolation period as a positive case can actually be shorter than your time as a quarantine case, which is 14 days.
Okay, thank you.
And then Susan, I know looking at that email you had forwarded us from DPH yesterday, talking about the new testing standards that Irby had just talked about. It seemed like the other part would be trying to get testing locally. I know you and I had just a quick conversation that before the meeting, and I'm not sure if when you had your call with the other area health directors, what their thoughts were in trying to get testing in town, whether testing for COVID or the antibody testing. It seems like there's nothing out from the state yet that is requiring that, but I guess the question more is if residents are looking for that, sources of that, and then is that something that potentially we in the town could inquire about, and whether that comes at no cost or insurance would cover it?
Yeah, I don't know who to ask. No, the other towns I talked to right at the moment, they weren't doing anything. I did put the question to the command center, the COVID command center, just to say, how does that get set up? Because you hear about it on the news, and then people say, well, why not my town? So I don't know, Irby, do you know how, is it the centers that bring it in? How do you get testing in your own community?
I'm not sure about that, but there is a website that does list all the testing sites So if you were looking for a testing site, and I think we're going to post it on the town website as well. I had sent the link over so that if you do get named as a contact and you want to get tested, you choose to get tested, it gives you a list of all the testing sites in Massachusetts. But in terms of getting it set up in our town, I'm not sure. I could ask. I could ask around to the other public health nurses to see if they have an answer and get back to you next week.
Yeah.
Or sooner than that. I mean, we can talk about it. And then you
Yeah,
can
good to know.
Okay.
Thank you.
As an FYI, the link in that email you would forward us, Susan, to the state listing of testing sites is an invalid link.
Yeah, they sent a revised one
Okay.
a little bit later.
Good.
I'll look for it and send it to you.
Okay. Thank you. So I guess in the remaining couple minutes, so it sounds like, I guess just to recap that it seems like really from the board's perspective, we're all on the same page that we really need to make sure that collectively we're working on the education side, and hopefully we can reinforce that with science behind why these things are being done, and really get consumers mindful of the fact that they can vote with their wallet or pocketbook. And I like your idea, Charlie, of having, if we can, some type of a signage at the entrance to a business or a store that sort of lists, these are the items that we are going to be doing, because self-policing is definitely going to help. I was at a big box hardware store in a town other than Tewksbury on Friday, and I was surprised that while all the customers walking in were all wearing masks, there was no one counting to make sure that they were not exceeding 40% of the occupancy limit based on total number of customers and staff. And the manager wasn't wearing a mask, and while the customer service personnel had masks on somewhere around their neck, but most would be pulling down when they were talking. And this is a customer service desk, customers that were lined up were silent about it. So I'm hoping that this trend will sort of change, that customers will be willing to mention something, but I think part of that would be, they'd be probably more apt to mention something if there is some type of a signage outside the entrance, sort of saying what people should be doing inside, both customers going in and what the staff are doing.
That's not a bad idea.
I think you would. Mr. Chairman,
Yes, Mr. Rue.
I think you're right. And the customer always has the option to turn around and leave.
Correct.
Yes, thank you for that. Oh, I just want to reiterate and remind everyone that that date of Monday, or the 18th, is a date of, it's not a date of everyone can start to reopen. Please, listen to the governor, look it up online, call us if you need to, but there's no starting gun, as the governor said.
Mr. Chairman,
Yes, Mr. Rue.
along those lines again, I'm still looking for a way that either Representative Robinson or Representative Nguyen or Seth Moulton, whoever the hell's out there, can push this rope uphill to Governor Baker, because Tewksbury's ready. I don't know about Lawrence. I don't know about Wilmington. Oh, by the way, they just closed Silver Lake for the season, I heard. But Tewksbury's ready. And if Jim Maselli was alive, he'd be pushing that issue through the State House. And I'm sure of that. That's all I have to say on that. Thank you.
And one of the things that is being looked into, as I mentioned, started my opening comments, is whether the advisory committee or the governor is going to say the state has control over the businesses reopening and all that, or how much of that, if any, would be pushed down to the local communities. And I think it's clear from what you were saying, Charlie, and the rest of us, that we're hoping on one aspect that that's more of a local community decision, because each community is different, both in how much COVID has impacted the local residents, as well as the impact to businesses. And no two communities are the same. So we can definitely reach out to our elected officials and just make sure that they can push to allow us flexibility more at the local level and not have it just at the state level edict.
I appreciate that, Mr. Chairman. Thank you.
Yep, duly noted. So in the last couple of minutes, anything else, any final questions or comments from any of the board members?
I didn't get a chance, Bob Scarano, I didn't get a chance to chime in on the enforcement portion of the
Go right ahead.
suggestion. And I don't know if I missed everybody or heard everyone's comments, but I would be hesitant to go forward with enforcement only for the fact that it may not be consistent and might lead to a charge of selective enforcement. Enforcement really needs to be consistent, and it needs to be a program that would have to be policed in itself to make sure that it was fair and consistent so as not to raise the specter of unequal treatment. I would be at this time hesitant to move in favor of enforcement.
Bob, you know what? That's a valid point, and I agree with you. When I had mentioned the potential for enforcement, that was based on the standard guidelines effective as of such and such a date. And so I totally understand where you're coming from, and I do agree that there's potential pitfalls, but I don't know. I think that we should but my experience on the Board of Health has been that, and I don't see how it can be selective if we have a minimum guidelines. We're not talking, that they have to do these crazy things, but if minimum guidelines are set by the state haven't been followed, maintained, then I don't see how anyone could consider that selective enforcement.
I agree with you
if you could just.
I agree with you with that prerequisite that had you had some experience where people weren't following the guidelines, and that's demonstratable, and you've documented that, and there appears to be a problem,
absolutely.
Then you would have justification for enforcement.
Correct. Yeah, I'm assuming that. Yeah, that's good. That makes sense to me, Bob. You got to document it, and you have the guidelines. But we're talking the bare minimum guidelines. I mean, nowadays, I hate to say it, people are snapping pictures, doing things, and I think it can be documented. And I'm not saying that they got shut down or whatever, but I think selective enforcement. I think anyone at these times now. I think they're going to have a hard time with saying it's selective, but I do agree with everything that you said, Bob, because that's what they have to be aware of it, and they should. But we're talking minimum standards. We're not talking craziness. But maybe you have some guidance that you can share with us on that too, because that's a valid point you brought up.
Mr. Chairman.
Yes, Mr. Rue.
Charlie Rue again. To Mr. Scarano. How you doing, Bob? How was that quarter pounder,
Charlie?
Good.
It was wonderful, and I wish I only could have delivered them in person to my fellow board members.
I'm going to get one right after we hang up here. But my point to Bob would be that if we have a reopening plan that would incorporate everything the state, obviously incorporate everything the state has edict to us, and the reopening plan itself, wouldn't that, by virtue of the fact that it's in writing and approved by the town, that wouldn't be selective if they were violating one of those actions that they claimed they were going to use to reopen? No?
No, I agree. It's just that you can't catch everybody. And what I mean by selective is that you can't enforce it equally across the board. And anybody that's anybody that's singled out as violating, I guess the enforcement part is the part that I'm a little sensitive to. I guess you could give a warning and say, hey, we have guidelines. Are you unfamiliar with them? And hand them a sheet of the guidelines. That would certainly be due process enough so that if I seen the same person hanging at the same lamp pole the following day with the same MO, I'd be able to do something a little more proactive in that regard. But don't you think that we have to trust the people to take control of their own situations, be aware, be vigilant, be alert for your own protection? And certainly if you've seen an abuse, that's a reportable event, and maybe at some point that abuse can be followed up on. But let's not get bogged down in enforcement when we have a job to do, and that's to keep people safe. Enforcement's not going to keep them safe. Education, you talked about it, getting and making sure they have the guidelines, posting them in the businesses, making sure everyone's policy is known. That's going to be much more effective than slapping someone's hands and singling them out for abuse when I think there's a lot of social pressure out there that is keeping people in line right now. People have done very well staying home. People have done very well covering up. I think people have covered and followed Charlie Baker's orders very well in Massachusetts. I can even see when I'm in New Hampshire, I can see the effect of the Massachusetts orders on New Hampshire people. No mask required up there, but I'll tell you one thing, everyone's wearing them. Everyone's wearing them going into the public places. The spacing's been great. So from state to state, I think compliance has been pretty good. I think enforcement might be a little bit early, and I think emphasis on the guidelines and following the guidelines until there's an abuse, and then socially embarrassed might be the best course of action.
That, Bob, I'm fine with that, and I do like a reprimand's good. I mean, simple things like I haven't seen it as much lately locally, and I think it's been good. I see the signs on the highway or on 38 about disposal of things. I mean, I'm talking about things that, like I said, like Charlie said, they're definitive. They're on there, and even if it's a, like an awareness board of reprimands, what I worry about is that once people get back to the business of business, they start to forget to make sure that their staff, and this is we've had these issues come up with the Board of Health, why people have to be brought before the Board of Health for an explanation and a reminder. So when I meant enforcement, we're not talking about dragging people out and doing things, but maybe in a perfect world, yes, everyone should be doing it because it's the right thing, and they're doing it to protect themselves and the community. But I've just seen some abuses of it, and I just think that I can't see it being selective if it comes to that, a warning or whatever. But, I know in the past I have seen similar situations that have been repeated more than once after being addressed, and that troubles me. But hey, I agree with you about it. We do have to tread lightly on that. So I'm all for education and doing it.
I had one other quick point. I noticed several towns came up with their own little 3-step slogans, and they put them on the political type signage and put them around town, like stay home, clean your hands, be alert. These are little messages that I thought we might have a budget for, or we might be able to have a few of those signs made up. Those seem to be very effective, especially, how political signs are at the intersections. Having safe messages at the intersections might be a more effective way to keep these people on their toes And those signs really seem to be prevalent, and they seem to be followed where I've seen them. Might be something to look into. Don't know if there's a budget to do those type of political signs with safety protocols on them, but it might be something to look into while we do this reopening, so it's fresh in the people's minds what the protocols are.
That's a good point. That's always good. Education is always good.
So
But
Richard and
that's all I
Susan,
have to say.
okay. Richard and Susan, any final words for us or comments?
I'm all set, Mr. Chairman.
Okay,
The weeks go by fast, Mr. Chairman. Now,
they do.
remember, next week is also our monthly meeting on Thursday, just a reminder.
Yep.
And what did we
Okay.
decide for Wednesday?
I guess, Richard, are you fine if we were to shift this to Wednesday at 1?
Yeah, that would work fine. Yeah,
Okay. So I guess we'll look at shifting our meetings to Wednesdays at 1.
Okay, I'm all set.
Okay. Mr. Rue, I think it's your turn for your motion.
I've got a 3 o'clock appointment, Mr. Chairman, for an illegal haircut. I don't know who to turn myself into. That being said, I'd like to make a motion that we close today's meeting.
Okay. And who'd like to second the motion?
I will second the motion.
Okay. Motion's been put forth and second to adjourn today's emergency meeting. All those in favor signify by saying aye. We'll do this as a verbal roll call. So Maria Zaroulis,
Aye.
Charlie Rue,
Aye.
Bob Scarano,
Aye.
Dr. Bichetti,
Aye.
and chair votes aye as well. So motion carries unanimously 5-0. So it is 2:07 p.m. Good afternoon, Tewksbury.